A very good afternoon to everyone. Welcome to today's session on failure up of high-risk neonates. We would like to welcome Dr. Imran, our in-house consultant, DNB Neonatology, to discuss today's topic. He has done his MBBS, MD, Pediatrics, DNB in Neonatology. Thank you, Doctor. Please, you can take over the session.
Yeah. Thank you, Dr. Chadra. Good afternoon to you all. My name is Dr. M.D. Imran, neonatologist at Apollo Creative Hospital, Brookfield, Bangalore. So today I'm going to discuss about a very interesting topic, especially when the baby is born preterm. The job doesn't finish when the baby has left the NICU. Essential follow-up and appropriate follow-up of these high-risk neonates is also necessary. So to begin with, I would like to start when the fetus is inside the womb, the environment surrounding the baby is very conducive for fetal growth. The fluid surrounding the baby has plenty of growth factors that is responsible for the growth of the baby as well as the organs inside the baby. And the surrounding environment is also protected by noise and light. So it is a soothing stimulation for the baby that helps in appropriate growth of the child. So when the fetus is inside the womb, it undergoes plenty of changes inside the brain as well. So to begin with, the nerve cells are formed, then they branch, they increase in size. There is plenty of changes that is occurring inside the womb. Once the baby is born preterm, the brain develops in a hostile environment in the NICU because majority of the babies born preterm, they are shifted to the NICU because of various other concerns like difficulty in breathing, difficulty in feeding, low sugars, etc. Even the environment in the NICU, sometimes there may be bright light, excessive noise, and also plenty of procedures that are undertaken that are painful for the baby. There are also risks of low oxygen values, low sugars, intracranial bleeds, and infections as well that impair the normal development of the baby. So when the babies are born preterm, there are plenty of concerns for the parents. Will my baby survive? Will my baby become normal in the long term? Or develop other complications like cerebral palsy, cognitive delay, developmental delay, or any other behavioral disorders like autistic disorder, etc. With the advances in the perinatal and neonatal care, although the mortality has decreased, the concern still regarding the long-term neurodevelopmental outcomes still remains. Hence, a proper and structured follow-up program is necessary for the early detection of the morbidities, and early intervention must be done to minimize these disabilities as far as possible. For doing so, first parents need to be counseled properly regarding the importance of the follow-up so that they come for a regular visits and the compliance rates of such visits improves. Before discharge itself, certain checklists need to be prepared and provided to the parents so that they can understand the importance of this follow-up and to avoid missing of the crucial follow-up services. The services I will be dealing it with later. Okay. The level and the frequency of such follow-ups also need to be based on the severity of the risk factors associated with a baby's condition. The follow-up protocol generally includes growth assessment, nutrition, development, vision, hearing, and other neurological status as well. Also, we have to keep in mind that the baby is immunized appropriate for each. And for all these regular follow-ups to occur, it requires a main establishment of a multidisciplinary team. It is not a single person's job. Requires a multidisciplinary team. Neonatologist and the primary care pediatrician are the key members to coordinate these services among the various specialties like developmental pediatrician, pediatric neurologist, ophthalmologist, ENT surgeon and audiologist, occupational therapist, and an orthopedician as well. It depends upon the risk factors associated with the baby. So the level of follow-up and the frequency of the visits is based on the severity of the risk factors associated. Why is this risk stratification necessary? What do you mean by risk stratification? Basing on the risk factors that is encountered in the baby during the course of NICU stay, it helps in assessing the severity of the risk in the neurodevelopment subsequently. It helps in planning regular follow-up visits and appropriate early intervention can be done, especially in these Indian settings, so that the outcome is better. High risk babies, especially, they require more support and more intensive follow up, and early stimulation is needed so that the outcomes are better. So I told about the risk stratification. So how you can categorize as which baby lands up in the mild risk, moderate risk, severe risk. So all the preterms like less than 28 to 30 weeks of gestation age, less than 1.2 kgs, they are little bit on severe risk factors. Also, when the baby weight is less than third centile, are twin pregnancies requiring prolonged oxygen support on ventilation, and other risk factors like the baby requiring heart support medicines, these all are come under high risk cases, and they require early and aggressive follow up. Not only these, some babies who develop low sugars requiring more oxygen support, more glucose concentration, more IV fluids and all, they are also come under this category. So as I told you, parents need to be made aware about these risk factors, and the intensity of the follow-up is needed. So to make sure that it happens before discharge, only certain checklists need to be prepared, and to make the parents enable to understand the importance of this follow-up. So what need to be done during the follow-up? What pre-discharge checklists are needed? The parents need to be made aware about the growth monitoring. So what does it include? It includes the weight, serial weight pattern, serial head circumference pattern, serial length monitoring and all. Because the brain develops till 2 to 3 years of age. So the head growth is indirect evidence about that the brain is growing in size. In the same way, how is the weight pattern? That helps in detecting whether any chance of infection or any other concerns are there that I'm going to deal with later. Not only about the growth, the other parameter that is important is the baby, preterm babies at the time of discharge are immunized or not. The babies need to be immunized as per the immunization schedule, because they are the more risk factors group for infections as well. And other lab tests like hemoglobin, sodium, calcium, etc. need to be done. Not only this, but other neurodevelopmental assessment, eye checkup, hearing checkup need to be done. The other parameter is screening for the rare inborn errors of metabolism, metabolic disorders, screening for congenital hypothyroidism, and as well before the time of discharge. Because thyroid is responsible for the brain growth as well. In case of deficiency, they may land up into mentally retardation as well. So to begin with, in the follow-up, what we are going to discuss is about the growth of the baby, because wellness of the baby is determined by how the baby is growing up during the follow-up. During the follow-up, not only the weight pattern, because most of the parents, what we see is if the baby is gaining weight, they assume that everything is normal. It's not the case. Not only the weight, but the other parameters like length and head circumference are also important. As I told, that the brain growth ultimately results in head circumference growth as well. But it should be within the normal ranges. Normal head growth is between 0.5 to 1 centimeter per week. Very rapid head growth is also abnormal, and slow growth is also not abnormal. So serially, when we plot the baby's weight, length, and head circumference on the growth charts is very important. That helps in indicating when is the insult beginning, when is the insult, how is it progressing over a period of time. So whenever the child, when you plot the weight, length, and head circumference on the growth chart, it helps to indicate whether the baby is faltering in the growth or not. The first thing what you are going to do is ensure that the baby milk intake is adequate or not. Ensure that the baby is well getting sufficient amount of vitamins, minerals, and iron supplements, etc. Normally, these preterm babies require vitamin D supplements till 1 year of age, and multivitamins till 6 to 12 months. Iron supplements need to be continued till 1 year of age, basing on the serum hemoglobin, serum ferritin values, etc. As well as these babies, preterm babies, tend to have little bit sodium losses more. As a result, the weight goes on a declining trend. Not only addressing feeding issues is important, but the other concerns like maintaining the normal temperature is also very crucial. In case all these are within normal limits, then we should also keep in mind about the infections as well. So what are the other medical concerns which we need to take care in such preterm babies? These babies are more prone for oral infections like oral fungal infections or any other disorders like gastroesophageal reflux that presents in the form of recurrent vomitings. But as long as the child is gaining weight, I don't worry much. But if the weight of the baby is in the decreasing trend, we have to evaluate accordingly. Other surgical conditions like inguinal hernia, umbilical hernia, undescended testes, these also need to be properly monitored. Preterm babies are known to have hemangiomas. These usually resolve by 1 to 2 years of age, but they need to be monitored whether it is increasing side, whether it is coming down or not. That is also very important. A complete physical checkup during the time of follow-up is needed because sometimes some abnormalities may have an impact over the neurodevelopmental outcome, such as whenever the child has any developmental dysplasia of the hip, like that, when they need to be screened with ultrasound hips, because sometimes what happens is the ability to stand, walk, and all these may get delayed because of such defects. Apart from the growth and nutrition, the other important aspect, as I told earlier, is the neonatal immunization. Why is it important? Preterm birth is associated with increased mortality and morbidity. The main cause is infections. When they are immunized appropriate for age, the risk of such infections and hospitalizations that is more common in such preterm babies also decreased. The why they are more prone for infections, they are because majority of the babies who are born preterm, the last trimester in the baby, the mother plays a crucial role for transfer of the maternal antibodies to the baby. When the baby is born preterm, such antibody load gets decreased and their antibody levels get decreased in the baby, as a result of which they are responsible for causing more infections. It is appropriate that the preterm babies vaccinate as per the immunization schedule and do not get delayed. It is quite common we see that the babies who are born preterm, the vaccination gets pretty delayed in the follow-up also, because there are certain misconceptions among the parents that vaccination have more side effects. But what we have to keep in mind is the outcome because of the infections, it is more harmful than the vaccination related side effects. So they need to be immunized as per the schedule. Safety concerns and fear of adverse effects are the more common reasons why these vaccinations get delayed in such preterm babies. But what we should also keep in mind that because of the infections, it may also result in rehospitalization rates are more. Not only the babies need to be get immunized, but also maternal immunization is the one of the major steps that helps in reducing the infection as well. Usually the flu vaccines and the other DTaP vaccines, that is the pertussis, diphtheria, tetanus vaccines, are being administered in the third trimester of the mothers because the antibody level is gradually increased and they are transferred from the mother to the baby. But once the baby is born preterm, they usually get missed in the mother. We should keep in mind that these vaccines are taken by the mother prior to the time of discharge. Not only the mothers but the handlers of the baby like grandparents and other father as well, they need to be administered flu vaccines. This step is known as cocooning. What does is selective vaccination of such close family members. They help and protect the newborn baby against these vaccine preventable diseases by decreasing the transmission rates. So it would be ideal to vaccinate even the family members with flu vaccines before the time of discharge. The most important aspect in my topic is about the neurodevelopment. So what we need to keep in mind is development occurs, it depends upon the brain growth. So the milestones and developmental milestones need to be assessed as per the corrected gestational age. So you may ask, what is the corrected gestational age? What does it mean? So for an example, say suppose a 28-weeker at the time of birth, the baby is born 3 months prior to the expected date of delivery. So once the baby is discharged, and say suppose the chronological age is 6 months, so at a chronological age of 6 months, the corrected age will become 3 months. How is it? Because the baby is born 3 months before the expected date of delivery. So during the chronological age of 6 months, we have to deduct 3 from the 6 months. So the corrected age of a preterm baby at 28 weeks, when it is at 6 months, is 3 months only. So the developmental milestones should be assessed at 3 months, whether the 3 months developmental milestones are attained at this point of time or not. So to assess, various developmental screening tools are available as an OPD basis, like developmental observation card, Preterm development screening charts. Other screening charts are available, so they can be done quickly in an OPD basis. But what I would suggest is, in such preterm babies, especially high risk factors group, it is ideal that detailed developmental assessment is done, which requires some. It is time consuming, and it to be done by the developmental pediatrician requires more time support. So various scales are available, like developmental assessment scale in Indian infants or Bailey scales in Indian infants, etc. So as per possible, there are certain red flag signs of neurodevelopment that I am going to share with you. So make sure when the baby is born, like at the time of discharge, the baby can see, hear, and listen. So it is very difficult to judge very early. So what at a point of 3 months of corrected gestation age, make sure that social smile is present. What does it mean by social smile? Looking at the mother and smiling. So what you can assess at this point of time at 3 months of corrected gestation age is the baby vision is good. That's the reason the baby is looking at the mother and smiling. So that helps in assessing a crude way of assessing how the early neurodevelopment is there. So in case the baby doesn't attain social smile by 3 months, there is some deviation from the normal. You need to visit for a developmental checkup. Not only these, there are other developmental milestones that are concerning, and red flag signs are when the child doesn't attain the head control by 5 months of age, when the child doesn't sit with support by 8 months of corrected age. So what here is important is the corrected age. 8 months corrected age, the baby is not sitting. That is a sort of concern. Not only this, if the baby is not able to stand by 1 year of age, by the 1 year of corrected gestation, it is also a sort of concern. The neurological examination of the infants and in a toddler group and child is an integral part of the follow-up. Infants with mild and moderate abnormalities may improve over a period of time. This is known as neuronal plasticity. It is nothing but the brain has a tendency to heal itself. So we have to give some support, early intervention, so that the neuronal plasticity occurs better. However, there are also situations where the infants with severe early neurological dysfunction, unlike to make up because of lack of proper care and lack of neurodevelopment outcome is a little bit grave also when the severity of insult is more. Pediatric neurologist opinion is ideal to be taken at the term corrected gestation age, that is at the level of 40 weeks of gestation age. What they will be assessing is how the baby posture is, how the baby movements are there, how the baby reflexes, whether there is any asymmetric of movements or not, whether the baby is able to move only one limb, whether there are other certain factors that can be taken note of, and make sure that helps in serial monitoring over it, that helps in early intervention, so that the outcome of such movements are better during the follow-up. So it is not a one-point assessment. Serial monitoring need to be done by the pediatric neurologist too, and regular follow-ups visits are needed as per advice by them. Neurodevelopment screening does not stop at infancy. They are also at risk for cognitive disability, behavioral problems, autistic disorders, etc. So in such various screening tools are available, like language evaluation scale and IQ testing for at 3 years of age, that need to be done according to the according to the age of the child. So all VLBWs and ELBWs, that is the less than 1 kg babies, they need to be followed up till adolescence for early identification whether there are any school difficulties or learning problems. Apart from the neurodevelopment, eyes checkup is also important. So what we know is the preterm eye baby's eyes are not developed at the time of birth. The blood vessels that supply the retina, the visual part of the eye, they are not developed completely. So they take around 40 to 44 weeks of corrected gestation age to completely develop. So screening for such babies less than 34 weeks and less than 2 kgs, they need to be done by 3 to 4 weeks of age by the ophthalmologist. The periodic checkup is needed so that the abnormal development that can lead to blindness. So periodic checkup is very necessary. Not only this, the vision also affects the other neurodevelopmental domains that I'm going to discuss later. Apart from this ROP screening, subsequently, even though the vessels have developed, they have been told the follow-up is necessary every 6 monthly till 5 years of age. The main reason is to check for any other abnormalities like squint, any refractive errors that require correction with glasses. As I have told earlier, that all domains of neurodevelopment depend on vision. All children with developmental concern require this eye examination. What you have to keep in mind is, as I have told earlier, when the baby smiles by 3 months of age at the time of 3 years, when the child is not showing such things, that means there is a poor face regard. And by 6 months of age, the babies usually tend to grab with the hands any small objects or toys. Whenever the child is not doing such things, that is also a sort of concern, because we have to keep in mind whether the child is able to see or not at that point of time. So apart from the eye checkup, the other aspect is the hearing screening as well, whether the child is able to listen. Why it is very important? Because hearing is very necessary for the baby to develop speech, vocalize. Okay, so it is mandatory that the baby can hear. So various screening tools like otoacoustic emission, OAE, are usually done at a time of discharge. OAE detects only the conductive part of the deafness, but the sensory neural, that is the neural part of deafness, should also be kept in mind in high risk babies. So OAE alone is not sufficient. In this scenario, they require higher modalities like BERA as well. BERA is brainstem evoked response audiometry that detects the neural part of the deafness, that is the inside part. So there is a rule that is known as, if the any ear abnormality, if any deafness is picked up by 5 months of age, the ability to vocalize is much better and picked up when intervention is done early. So it is mandatory for high risk babies in such situation. So as I have told earlier about these all, like nutrition, growth, development, immunization, among all these, whenever you are screening them, there are various modalities and early interventions available so that the outcome of such babies is better. So as I have told earlier, whenever there are neurodevelopment problems are there, speech, occupational therapy need to be done, physiotherapy need to be taken care of. And also in case of hearing defects, the baby may have a tendency to localize not better. In such cases, speech therapy is better there. Hearing aids are available whenever the child is not able to hear properly. There are also certain situations where cochlear implant can be done in such preterm babies during the follow-up, so that the outcomes of speech, everything is better. Even there are other pharmacotherapies, behavioral therapy for behavioral disorders, squint correction can be done, glasses for refractive errors, etc. So as I've told you, development is one aspect that is needed during the follow-up care. Everything need to be done. So proper checklist need to be provided. So I would like to end here. If there are any doubts, I would like to answer. Thank you.
Yeah, hi, doctor. There are a few questions, doctor. The first question is, what can I do before or during pregnancy to decrease my risk of having a baby with certain birth defects?
Yeah. So very good question, man. So it is very difficult to pick up before whatever is going to happen to avoid preterm birth, whatever is to be done. So regular follow-up visits are needed with your gynecologist. So in case you have like in a case of any pregnancy with previous history of abortions, we need to evaluate what is the cause of the such abortions. So the gynecologist will give you a clear picture, gynec and obstetrician will give you a clear picture, what was the reason of that such abortions, because there are various other conditions that is known as metabolic disorders, some syndromic features like Down syndrome or any Edwards syndrome, where such recurrent history of abortions will be there, history of any torch infections may be there that is responsible for causing abortions, that will have an effect and impact over the long-term outcome. So to avoid such things, we have to first identify what was the reason behind it. So at time of delivery, before the time of delivery, to prevent it, the only thing is what we can do. What was the cause of such abortions in the brain? In case this is the first time pregnancy, that it is very difficult to pick up to avoid such high risk factors and all. What we can do is early stimulation that can be done only after the time of delivery, not before that. So in case of previous history of abortions, that time we can give a little bit clear picture in such situations.
Right. The next question is, Doctor, what do I need to know about taking medications during pregnancy?
Can you please repeat?
Yeah. What do I need to know about taking medications during pregnancy?
Okay, so yeah, understand. So what are the medicines that is taken during the time of pregnancy is also very important, because especially during the first trimester, that is the first 3 months of pregnancy, there are certain medicines like anti-fits medications or any other medications that is responsible for the brain growth, because everything depends upon the brain growth that occurs during the first 3 months, but majority occurs during the after the time of delivery as well. So there are certain drugs like valproate, phenytoin and all that are responsible for causing some neurological defects subsequently. So it depends upon the, but here what we have to keep in mind is risk versus benefits is also very important, because why, whether the anti-seizure medicine that is responsible for such defects is necessary, really necessary for the mother, that need to be discussed with the gynecologist. So whether they need to continue such medicines or there are safer medicines that help to avoid such defects, that is very necessary.
The next question is, Doctor, what clinical problems may be faced by a premature infant?
Yeah, so that was the main talk, like clinical problems. The baby may have various medical concerns. So it depends upon all the risk factors which are present during the time of NICU stay. Say, suppose a preterm baby having difficulty in breathing and difficulty in breathing, having requiring oxygen support, ventilation support for a long duration. These babies' lungs tend to be immature. Some babies, in some babies, require oxygen support for a longer time. Even after 36 weeks to 40 weeks, they require oxygen for a longer time, because the lungs, because of the certain trauma, because of undergoing during the case of NICU stay, because the lungs slowly tends to grow as the baby puts on weight. And there are other conditions like infections, meningitis, which will lead to hydrocephalus. There are certain complications where the babies tend to develop increasing size of the head. As the baby head increases serially beyond the expected limits, that is, I have told you, like 0.5 to 1 centimeter per week is the normal head circumference growth per week. In case it is growing more than the expected limit, what we should also keep in mind about a condition known as hydrocephalus, because hydrocephalus is nothing but the fluid accumulation inside the brain. Whenever more fluid is accumulation inside the brain, there won't be much space available for the brain growth. So in such scenario also, we have to keep in mind that early stimulation, that interventions for reducing the hydrocephalus, so that the outcome is better. Thank you.
Another question is, Doctor, is there a specialized health care for women and babies at risk of extremely preterm birth?
Yeah. So whenever the mothers who are at high risk of preterm delivery, I would advise one thing. So it is better to deliver at a tertiary care center well equipped with the NICU whenever whenever the pregnancy is around less than 30 weeks of gestation, around 28 weeks of gestation, other risk factors responsible for the preterm. It is better to deliver at a tertiary center because first whatever the events responsible during the first 3 days of life after delivery in the preterm babies that plays a crucial role in the long-term neurodevelopment, because during the first 3 days majority of the babies do tend to have like bleeds, intracranial bleeds that we need to take care of, that will have an effect on the long-term neurodevelopment. And it depends all about the mother risk factors as well. So in case she's having severely growth restricted babies, in case the mother is having high hypertension, we should also keep in mind about the pros and cons, whether the delivery is required imminently or can be waited, so that each and every week prolongation of pregnancy improves the outcome of a preterm baby. Says when the mother has come at around 28 weeks, if there is no risk of imminent delivery, we can wait for another 7 days in case everything is possible. That also improves the neurodevelopmental outcome subsequently. So a 28 weeker and 28 weeker, so the neurodevelopment varies based on the condition.
We've just got another question, doctor. Is that if my water broke, if the water broke at 5.5 months, can the baby survive?
Yeah. So it depends upon the at 5.5 weeks, 5.5 months means around 20 to 24 weeks, right? So it depends upon whether the leak is controllable or not. So whenever such leak is anticipated in a mother, immediately what you need to do is to consult your gynecologist, because there are few medicines available for reducing this active leak as well to prolong the pregnancy. So, as I have told earlier, each and every week prolongation of the pregnancy improves the outcome of the preterm baby. But we should also keep in mind whether delivery need to be done imminently at 22 weeks or 24 weeks, because the outcomes are improving with every week, right? So at 22 weeks, if the delivery is imminent, they need to undergo, because it is also responsible for the mother condition as well. It is very important in that aspect as well. So we have to check both like mother aspects as well as the baby aspects, whether the salvageable or not at that point of time. In that scenario, every time what we need to do is make sure that follow-up is done at a tertiary center where neonatal intensive care unit is available nearby.
One last question before we conclude today's session is, doctor, if my baby is born extremely preterm, will he or she need resuscitation?
Yeah. So extreme preterm less than 28 weeks generally require resuscitation, but so it all depends upon the severity of the baby at the time of birth. Okay, so when the baby is having more difficulty in breathing and all, requiring ventilatory support, and duration of ventilatory support is also important. So the longer the baby stays on the ventilator, the outcome will be little unsatisfactory compared to the babies who are on short duration on ventilator, or the babies on non-invasive ventilator. The outcomes varies. The baby on a non-invasive support, the outcomes will be better when compared to the babies on prolonged ventilation support. So definitely less than 28 weeks, majority of the babies do require some assistance in the breathing support, because the lungs are still immature. Although we cover with antenatal corticosteroids that helps in maturing the lungs a little bit, but still majority of the babies do require some oxygen support. It is very, very, very rare to say that the babies without oxygen support at a time of birth, without any resuscitation needed.
That was the last question, doctor. Thanks a lot for today's session and answering all the questions patiently and for the informative session. We look forward to having you on more such sessions, doctor. Thanks a lot for your time. Thank you.